Naranjan Dhalla from St. Boniface Research Hospital Research Center in Winnipeg, Manitoba, and I am the Executive Director of the International Academy of Cardiovascular Sciences. At the University of Manitoba, I am a distinguished professor there, and so we have been involved with promoting the scientific basis of cardiology. Today I had the opportunity of presenting some of our work on sudden cardiac death. You see, sudden cardiac death happens in both healthy individuals, particularly with sports people also, and also with patients with a lot of diseases such as hypertension, diabetes, renal failure, heart failure. And today I presented some evidence that yes, I think what people believe, that there is a massive amount of arrhythmia occur in sudden cardiac death, and that's why people die. And the defibrillation is the only answer up till now for taking care of the people who are going to die of sudden cardiac death if they come in time to the hospital. And so people believe that there is the activation of sympathetic nervous system takes place, and this activation of sympathetic nervous system produce a lot of catecholamine which circulate in the body, and they lead to arrhythmias. But the real mechanism how these high level of catecholamine produce arrhythmias is a really debatable question. A lot of people think that it acts on beta receptors and then activates cyclic AMP. But when you give the beta receptor blocking agents to healthy individual, still the sudden cardiac death occurs. And so it may not be the catecholamine per se, but we found out that it is the oxidation of catecholamine which may be important. So during oxidation of catecholamine, two things are produced. One is the oxyradicals are produced, and that creates oxidative stress. And the other one is that adrenochrome is an oxidation product of catecholamine, which is very toxic. We showed very carefully that the adrenochrome, when you inject to the animals, it produces arrhythmias, and exactly the same thing what happens in the sudden cardiac death, the ventricular fibrillation takes place, and that can be prevented by antioxidants. I showed the cases of 2-3 accidents, antioxidants today, where we showed that the fibrillation was prevented and the intensity of the arrhythmia was markedly reduced. And so here is a situation. I think the antioxidants, particularly when they are given to the patient with heart failure, they may not prevent the pump failure, but what they may do is that they will prevent the sudden cardiac death. So I think it's an antioxidant may be preventive measure. I think it should be considered seriously, that antioxidant may be very useful for preventing sudden cardiac death in wide variety of situations, including in some athletes who are, I hope sports medicine is not preventing the use of antioxidant in their cases, but antioxidants will be very good, very useful. And particularly if there is a person with renal failure cases, there is a sudden death happen, I think even they should take some antioxidant. So this is what I presented today, that use of antioxidant as a preventive measure, not for the treatment. I think they exchange ideas. I think Dr. Kimchi has done a wonderful job in organizing this conference every year. And what he has trying to prove is that trying to promote the understanding of translational medicine, that people from various disciplines get together and they talk about their own things, and so that compositive nature of the how from a bench to the bedside things can take place And I think this is a very important aspect of this. So exchange of ideas in a multidisciplinary way to improve the understanding of heart disease as well as to find the improvement of the therapy of heart disease. So two aspects are achieved.